So, with all the problems that we talked about, what helps? What helps deal with all of the stress that you experience as a caregiver? Well, one of the things is really we're going to talk about ways to reduce the amount of stress that you experience. This slide kind of hits a lot of different things, a lot of different coping strategies. And it's just really to take a look at what has worked for you to cope with stress in the past. What has worked that maybe you stopped doing? What do you need to put back into your life? Or what are you doing that isn't working? Maybe it's time to start something new. So we're going to kind of breeze through some of these things, but really it's about finding coping strategies that are individualized and that work for you. Because caregivers often put their own needs aside, and the first thing to really go is kind of your physical health, it's important that we're looking at the ways to cope physically, because stress has a physical impact on our body. And so it's important that you're looking at, getting enough sleep, getting some physical activity, getting some exercise, and eating nutritious meals and eating regularly. And following up with your own medical care or your own dental care. I think these are sometimes the first things to go for somebody when they're focused on someone else's health and medical care. But these things are really important to keep your body, functioning properly and moving forward. The other thing is that when we're stressed, we are triggering our body's internal fight or flight system. So that happens when we are feeling threatened, when we are perceiving a threat, whether that's an external threat or an internal threat, like a worry or something about the future. But our body kind of ramps up during that time. Your heart may quicken, you might feel shortness of breath, the oxygen in your body is kind of flowing to large muscle groups, kind of preparing your body to fight, kind of stay and fight, or to flee and to run. So with chronic worry and stress and anxiety, is that this can have really lasting effects on our physical health. And so it's important to counter that process within our body and to train our bodies to exhibit our relaxation internal system. And we do that by practicing. And if you're not used to doing it, it does take some practice, but it's really important that you're finding ways to relax. So that may be through meditation, diaphragmatic breathing, which is really just slow, deep breaths, breathing in through your diaphragm. So not the short chest breathing, but in through your belly. Progressive muscle relaxation. Sometimes we don't even know that we're feeling stress or tense until we actually start to pay attention, and then you thought, oh wow, my shoulders are a little tight. And when you pay attention to it, you can kind of then also pay attention to relaxing your shoulders. So flexing and releasing large muscle groups kind of helps your body notice that change in sensation and work on that relaxation stage. Guided imagery, trying something new, yoga, massage, and really the bottom line is, again, it's just finding something that works for you, because relaxation is a large part of countering stress.